Hello, this is Annie Gracie, Assistant Professor, Department of Biomedical Engineering from Beltech Multitech, Dr. Rangarajan, Dr. Shakuntala Engineering College. Today we are going to discuss about the therapeutic applications of COT lasers. Here, the COT lasers are widely used in laser types, right? Uh, in therapeutic equipment, it plays a most major role. This technique is based upon the wavelength and clinical benefits. Okay, then here CO2 lasers emits infrared light with high power, which making it suitable for precise cutting, vaporization, and removal of soft tissues with minimal bleeding. In contrast, the He and Ne, which is explains the helium neon lasers, which emits low power red light, continuously used in physiotherapy. Okay, the HENE lasers are used for physiotherapy purposes. Okay, for pain relief and wound healing and tissue repair. Together, these lasers play a vital role in modern medical and therapeutic procedures by providing non-invasive control and highly effective treatment options. Okay, because of these lasers are not harmful, but it may have a less side effects, right? All lasers are not good. Even though we have to take an example for X-ray, we are taking an X-ray. The X-ray is penetrated. The X-ray is not harmful, but if it is repeatedly, then it will cause some side effects. Okay, then we will move to the next slide. The working principle of CO2 lasers. Here, the principles which have four options in this active medium: energy input, the energy is the excitation process, then the inversion process, then the action of the laser, then the optimal resonators. Okay, let us see about the active medium. In active medium, a mixture of CO2 and an N2 and He gases acts as the lasing medium. Okay, the lasing medium is the mixture of these three gases only. For energy input, this is an excitation. The electrical discharge excites nitrogen molecules, and it excited nitrogen transfers energy to CO2 molecules. Okay. Then inversion process, the CO2 molecules reach a higher energy state, then creating a inversion process. After it reaching the higher energy state only, it can able to create an inversion process. If it not go to a higher energy state and l- maintain it in a moderate state itself, then there will be a not an immersion. That will be it, in an excitation itself only. Okay, then we will move to the laser action. When CO2 molecules are used to return the lower energy state, we are seeing that the excited state, lower energy state, then what I would say, yes, higher energy state, lower energy state, and medium energy state. Okay, then excited state. Here we have in previous slide I have told about the He and Ne. Here the CO2, where CO2 is the carbon dioxide laser, which is high power laser that uses a gas mixture of these three as active medium. It produces infrared light, which of 10.6 μm, which is strongly absorbed by water in tissues. Okay, making it the ideal for cutting, vaporizing, and coagulation soft tissues in medical and surgical application. Mostly, the CO2 lasers are used for surgical applications in medical purposes. Okay, um, then let me move to the laser action. When CO2 molecules return to a lower energy state, they emit infrared radiations. As I told previously that the CO2 which is used in medical applications and with the radiation of 10.6 mm, right? Then the optical resonators, which has two mirrors, one is fully reflective and one is partially reflective, which amplify the light, right? The partially reflective mirror only allows the coherent laser beam to exit. Then let me move to the next slide. Here, let me see the construction of CO2 lasers. Here the CO2 lasers which has a gas inlet pores. In this gas inlet pores we will have HEN, helium, nitrogen and carbon dioxide lasers. The laser tube is filled with a gaseous mixture of carbon dioxide, helium, nitrogen. As I said, here the carbon dioxide which is a lasing medium, and nitrogen which helps in excitation, and helium which improves the efficiency in cooling. These gases are supplied into the quartz discharge tube. Let's Here this is the quartz discharge tube. In from the outlet, the three gases are continuously inside, moving inside the quartz discharge tube, and there is a vacuum tube, and there is a power supply port, and here this is an NaCl booster window. From these the gas is passed and reacting with the NaCl, then the laser will be emitted, right? I've told two mirrors. In this the second mirror is a partial reflecting mirror, so it's and here one mirror, and here from the partially reflecting mirror only the laser will be emitted, right? Okay, let me move to the next topic. I have discussed the construction of CO2 lasers. We will elaborately discuss it in the working procedure. The CO2 laser uses gas mixture of CO2 N2 helium inside a quartz tube, as I told. Here, high voltage power supply excites nitrogen, which transfers energy to CO2. Then, excited CO2 molecule produces infrared laser light when they return to a lower energy state. Then, the sodium chloride boosted windows allow the polarized light to pass with minimal loss. A fully reflecting mirror M1 and M2. Yeah, I was told right. In this two mirrors we are using, which is a optical resonator. These two optical resonators M1 and M2 and M2 are the fully reflecting. Uh, that's why it's mentioned here. The laser beam excites through the partial reflecting mirror or the useful output. Okay, the fully reflecting mirror is not useful. It can be an option, but the major light reflecting will be done in the partial reflecting mirror. Sorry, the laser. Yeah, let me discuss about the advantages. Here, advantages produces a high power output suitable for cutting and vaporizing tissues, minimal bleeding due to excellent coagulation properties, high precision with very fine control of P, causes minimal damage to surrounding tissues, fast healing, and reduce the post-operative pain. Okay, because of the lasers only, you can able to heal fast, and because of faster healing property, the pain will be reduced, which works effectively on soft tissues because of strong absorption in water. Then it provides a sterile surgical field since the beam kills bacteria. The beam itself having the sterilization unit, so it can able to the atmospheric bacterial, fungi, and all no that can be killed before entering the beam itself. Okay, next, move to the next slide. And applications in medical devices. Dermatology, the field of dermatology, it removes of burns, moles, scars, tattoos, and the skin. And in ENT services, the CO2 lasers used for the treatment of vocal cord lesions, nasal polyps, and tonsillar tissues. In gynecological purposes, cervical lesion treatment, vaginal rejuvenation, and endometriosis vaporization. Then in general surgery, we are using for cutting, coagulation, and vaporization the soft tissues with minimal bleeding. Dental procedures, gingiviectomy, tooth exposure and removal of soft tissues, lesions, plastic surgery, light the skin tightening, scar revisions. Then let me move to the next slide. And this is the conclusion. The COT lasers are used mainly for not to exceed the more pain and not more bleeding. Right? This is the main advantages. Their excellent absorption in water makes them ideal for medical and surgical applications. And thank you. I'm going to wind up this session. I have know that you have gained some knowledge through this video. Thank